mute myself and we're going live now.
Thank you. Good evening, everybody. Lovely to see you joining us. I say see you, obviously we can't actually see you, but it's really good to have you here with us in the room. Welcome to our Parent Carer live event. I have the real privilege this evening of introducing a number of colleagues, both from the local authority and from our clinical commissioning group, and I'll do that in a moment, as I will also introduce myself. It's really lovely that you've taken the time, and thank you so much for doing so. We are scheduled to be with you until 7:45, but if we think that the questions are running out, then we won't keep you later than we need to. We really want this to be an interactive event. I know we can't see you, but there is a chat function, a Q&A function that sits alongside this Teams event. So at the top of your screen, you should see a little speech bubble where you can ask us questions. Now, some of those questions we might well choose to answer you directly, and some of them we'll publish and make sure that everybody can see. We'd like this event to be about general themes and things that you've noticed and things you'd like us to answer. We try not to focus too much on individual issues. If there's something that you specifically want us to think about, then we'll probably contact you directly rather than publish that out to everybody that's attending. So as I say, good to see you. We will be publishing this live recording as well so that you can review it afterwards. This is the second event today. We ran one this morning, had quite a number of people with us, and it was a really good, lively event. So we hope that it'll be the same again this evening. And we will also publish the questions from the two sessions as well, so you can review those afterwards. There'll be a number of things that we'll need to take away and come back to you on, a lot that we'll hopefully come to today. So what I'll do is I'll introduce people that are with us this evening so that you know who's here. And this is going to be a very fluid session. We're not presenting anything formally to you. We definitely want for you to have this opportunity to ask us questions while you've got us all together. So I'm Kath Saunders. I'm one of the heads of locality and strategy within Children's Services, and North Locality is my area. But I'm also the strategic lead for our operational SEND service. And so the frontline SEND teams are part of the service that I look after. And there may be bits that I'll expand on during this evening, depending on the questions that you ask. So I'm going to hand across now to Lisa Linscott and then to Miriam Lee and Hal Williams, who are here from the local authority.
Good evening, everyone. I'm Lisa Linscott. I'm principal teacher for Dorset, which means that I'm responsible for school improvement and children missing out on education and elective home education and attendance.
Good evening, everyone. My name is Miriam Lee. I'm the Principal Educational Psychologist, and that means I have a responsibility for the Educational Psychology Service and the delivery of that service. And we work very closely with our schools and health services and colleagues. I also have a strategic responsibility around the quality assurance and quality delivery of our special educational needs services. So I work very alongside Kath to ensure that what we're delivering is of good quality and the decisions that we're making are sound decisions. And I also work very closely with our CCG colleagues around emotional health and wellbeing, ensuring that we're delivering good services to children and young people, particularly around the early intervention around emotional health and wellbeing.
Hello everybody, my name's Hal Williams. I'm the service manager for children who are disabled, and that's the social care team in Dorset for disabled children and their families. We work with generally the most severely, profoundly disabled young people in Dorset. We aim to support those children to be cared for within their families. We provide support for parents, carers and for siblings. We do assessments and provide short breaks, so usually in the form of a direct payment or or providing overnight short breaks for disabled children to give their families a break, help with their care. We also do safeguarding work, child protection work, and we look after children in care, so children who can't stay with their families. And we have an occupational therapy team as well. So they do the bit of occupational therapy that's around home adaptations and making life easier, I suppose, for disabled children to live at home. So good to see you all. Good to be here.
Brilliant. Thanks, Hal. And it's a real pleasure this evening to have colleagues from the Clinical Commissioning Group with us this evening. So I'm going to hand over to Sam Best, Elaine Hurl and Steve Clark.
Thank you, Kath. Yes, good evening, everybody. It's quite nice to be here tonight. I think just to introduce myself, I'm Sam Best and I'm a principal lead for the Children and Young People's team at the Clinical Commissioning Group. I'm a nurse and a health visitor by background. Just to give you some idea of the scope of the work that the Children and Young People's team is involved in, we've got work programmes around the NHS long-term plan, specifically around improving quality of care for children and young people with long-term conditions such as asthma and obesity. We're also doing some work on developing the pathway for children and young people who have more complex medical needs and who need end-of-life care. And most importantly as well, we're also doing some work around how we work as a system, because we know that having a joined up system is a bit of an enabler and is a bit helpful. I thought what I would also do for you at the moment before I hand over is just to tell you a little bit more about some of the work programmes in depth. And firstly, I know that some of you may be aware that we've had the all-age autism review, and that is an ongoing piece of work. There has been, I think, some challenges recently with key personnel moving from the CCG, but we have had, I think, some very strong engagement from our stakeholders and some view seeking of children and young people, which has set us up to progress the pathway now. And what we're doing, just to tell you next steps, is we're revisiting some of our analysis of the information that we had, so we can build on a baseline. We're also going to look to implement one of our key recommendations, which is around developing a dedicated information website for neurodevelopmental information. We're also going to launch the Dorset Autism Training Offer for health, social care and education workforce. And of course, we want to work with you and provide better and more accessible communication about our project progress. And finally, just a piece of good news in terms of our speech communication and language needs pathway. As partners across Dorset, we have agreed some investment to develop and improve services that will hopefully give additional support in schools as well. So thank you for listening. I'm going to hand you over to Elaine Hurl now.
Hello, good evening. Really nice to be here. It's a shame we can't see you because we get to look at each other all the time on the screen. So, I'm one of the principal programme leads for mental health commissioning. I lead on the children and adolescent mental health service work, but also have a few other areas in adult mental health too. So in relation to children and young people though, we've got a strategy that's been sort of started in 2016 but revised every year since, and in 2020 I did a lot with colleagues to meet loads of you and some of the parent care groups and schools, and did a lot of view seeking to see whether CAMS has improved and what our direction of travel should be. On the basis of a lot of that work, the new strategy launched in 2021 includes a lot of your views and thoughts, and it's a real shame because health services take quite a long time to change and develop, and it's a bit like turning a tanker sometimes. So there are things afoot that hopefully what you talked about you'll see changing. So one of the things is support for people in schools. We've got schools teams online. We should have another 4 coming online this year, which means that that's about 50% of the of Dorset and BCP covered with schools teams, and hopefully we're going to try and push ahead of NHS England to get more support into schools. We've got the Gateway service, which is single point of access for the whole of the CAMS service, which is designed really to speed things up for young people so that we don't have people waiting any longer than 4 weeks for treatment. But between referral and treatment, young people and their families should be accessing support in that time. It's not an easy ask because at the same time as setting up new service, the demand for the services sort of spiked. Not surprising given all the kind of COVID and lockdown scenarios. So it is one of those things that across our system there's pressure. And the other thing that we've got in line is crisis services coming online this year, fully funded. It's recruiting now, and you should be able to see crisis support for young people. That leaves the core CAMS services, the treatment services. We've got 6 teams across Dorset, and we've got 2 ID CAMS services. We're looking at how they need to work differently based on those other changes, and we're really seriously looking at the ASD work, because 50% of referrals coming into CAMS are young people who've got a neurodiverse condition. So those things are being discussed now, and over this next year we should be able to more publicly kind of say what our direction of travel is. So look forward to your questions and getting a good quizzing. So thank you. Thanks for inviting us.
Hello, everybody. My name is Steve Clark, and I'm Designated Clinical Officer for SEND within the CCG. You probably hear me referred to just as the DCO. It's my responsibility to have oversight of how health services are working with children and young people that have SEND and their families, and also how those services are working alongside our colleagues within the local authorities.
Thank you, Steve. Teresa, I think we're coming over to you.
Hello, thank you ever so much, Catherine. Thank you, colleagues. I'm delighted to be here with you this evening. I'm Teresa Levy, the Director of Children's Services in Dorset Council. And that means I have the privilege to work with all of these people on this call this evening, and hopefully in service to you and your families. And over the last 2 years, whilst I've been Director of Children's Services, I've been deeply impressed by how people are attempting to change the way in which we support you, change the way in which we get closer together, to integrate more, to get closer to you so that you can access the help as soon as you need it and not have to fall down through gaps and different doorways. And we're not there yet, but we know that's what you want, and we've heard from you very generously over all of that time, telling us that you need to be able to access us all together, access us whenever you need us, and us as one team. It doesn't matter whether we work for the NHS or whether we work for a local authority or whether we're in a school. It doesn't matter to you and your children, and we want it to not matter to us. So we're working really closely together, as you'll see this evening. We're working to make sure that wherever we can, we get you supported in early help space so that you can have early support for you and your child, and therefore hopefully be able to grow the life that you all want together with the support around you. We only do that when we're really well led by you. So thank you for attending this evening, because then you do lead us into the right places. Thank you for all of the contributions you've made over the last year and in such a difficult year. And I'm really looking forward to just listening and learning from you this evening, and making sure that when we hear what you tell us, we can respond and react to that. So thank you. Vic, I think. There. Thank you.
Thank you, Teresa. I'm Vic Firmer. I'm the Corporate Director for Education and Learning. So thank you for joining us this evening. The areas that I lead within the council are the work with our schools, as we've been working with them through the pandemic, of course. I lead our SEND service alongside school improvement, and then working with Lisa Lynn Scott around the virtual school, and then also lead our educational psychology and specialist teaching teams as well, and that interface with our academies, our maintained schools, and also the Department for Education around educational matters in particular. So those are the main areas. And over the autumn, we've been working hard on developing our new SEND strategy, and that was published, and there should be a link in the chat shortly if you haven't seen a copy, which sets out a number of areas, but in particular our vision and our new vision for SEND services, which is that we want our children and young people with SEND to be healthy, happy and safe, and to be able to achieve their potential to lead a fulfilling life. And we want them to have and to expect the same opportunities in life as other children and young people. And we know that in some aspects, we're not there yet, but there's areas to do. But there's a number of things that we'll cover today in the Q&A that we'll talk about where we're making really great progress. And our SEND strategy has 6 key areas. The first is around early identification and support. So links to a question that I think has come into the chat already around how do we support need early? How do we recognise need early? And in the context of educational recovery and the pandemic, how do we work with our schools, our health services, colleagues in the room, and together as a multi-agency partnership to make sure that we are identifying those needs early. And a couple of the things that we have been doing include launching our SENCO networks. We're working much more closely with our SENCOs to support them in terms of sharing and leading best practice. And we've also launched what's called the Dorset Education Advice Line, which is a phone line that you can pick up to help navigate what can sometimes be a bit challenging around our local offer, but also just to get advice on what are the kinds of things that that both the school could be doing, you could potentially be doing at home, and we'll give you access to colleagues in our educational team, which may be one of our SEN family workers, but also could be a specialist teacher or educational psychologist as well. So there'll be a link in the chat for the phone number, but you may have seen that advertised already. And we've had a number of calls already since that launched in October from families looking for support and just looking for some early advice. Our second priority within our SEND strategy is around inclusion in mainstream, and that's absolutely key for us in terms of ensuring that every child that has a right to be educated in mainstream schools is provided appropriate support, but also that we think about some of the places in terms of the physical spaces that we may need to create for that to happen as well. And one of the areas we're looking at is creating inclusion hubs, which are spaces on a mainstream school site, which means that a child can access the curriculum alongside their peers, but may also have some time in a specialist space with a specialist teacher for some support around the curriculum and interventions around that as well. And there'll be a number of those over this year, and previously these have been called CCN, so complex communication needs spaces, and the new name for that will be inclusion hubs, and we'll be rolling out a number of those over the next couple of years as part of our SEND capital strategy. And then also in terms of CPD, so we've been doing a lot of work around professional development for teachers through our outreach programme, and one of the areas there is how we've been delivering training to equip our teachers more so that they've got tools in the classroom that they can use to support our children in mainstream and deliver inclusive and differentiated education to children and young people. And that's all part of our wider offer, and we'll come on to talk about that, I'm sure, as there are questions as well. And then the SEND pathways, so my colleague Steve and Sam Best from CCG talked a bit about the pathway work we're doing as a partnership around speech and language, around the autism pathway, and you may have questions on that, and it's an absolute key priority in our strategy as well. Our fourth priority is around sufficiency, and we know that there have been challenges in our sufficiency in the past. Dorset Council Cabinet agreed a investment of £40 million to be spent over the next 5 years on a number of schemes, and the first of those schemes are already coming through. So that includes Bowcroft Special School in the East, which is expanding 75 places to bring on board more post-16 education, but that will also release capacity across all of their year groups. Coombe House School, which you may have heard of as St Mary's School or the Dorset Centre of Excellence, will be opening in the summer term with growing to 280 places, which is a significant increase in capacity in Coombe House. But we also have 2 free schools. So the Harbour School in Bovington will be opening to 160 children from April, and then also Osprey Quay, which is our new free school project, will be coming through hopefully for September 2023, and we're working closely with the Department for Education on that, alongside the inclusion hubs that I described earlier. So there are a number of places which will hopefully help us exceed the 500 places target that we have, and a number of our projects will already get us a long way down that line, but you should see more sufficiency coming down the line. And then our fifth priority is around transitions and that preparation for adulthood and making sure that we are supporting our children into adulthood. And there are a number of activities happening around that, and that's all published in our strategy. And then finally, managing our financial provision and making sure we're managing our resources carefully, and that's published in our high needs block management strategy, which is both about making sure we are managing value in terms of the independent market that we may be using, but also our own finances within that. So this is really your time. There's a couple of questions that have come through in the chat already, which we can come on to. So Kath, I may hand over to you to just navigate us through the first few questions. But yeah, this is your time whilst you have colleagues here, and very grateful for having you all with us this evening. So Kath, I'll hand back to you.
Thanks, Vic. So really good to see some of you making use of the chat function. Please do. As I said before, we may respond to you individually, and we may publish the question, and several of us may well put an answer on there. There was a question around young people who perhaps go a little bit unnoticed in schools because they maybe mask the needs that they have. And again, you know, we have an arrangement with schools, so every school, whether they're maintained or academy, has a linked worker within the local authority, so that we can have regular conversations about vulnerable young people, both for those that the schools are recognising and those that we know that we can see maybe have some additional support needs because you as parents and carers have talked to us. But we also now have the education advice line that Vic's mentioned. We've put some links, the telephone number and the online form there. You can either ring in and book an appointment, or you can use the online form to state when is the best time for you, and that's a 15-minute booked appointment with one of our SEND family workers, and that's quite a new area of work for us. Having our SEND family workers as part of our frontline teams has been a really good area of growth for us. Increasingly, we will be bringing our SEND family workers alongside you and schools and settings, particularly perhaps at times when we have to say no, and I know that can sometimes be a really difficult time for families. So maybe at that initial point of asking us for an education, health and care plan, and we don't perhaps have enough information to make that decision. And then later on, perhaps if we've actually carried out the assessment and again don't feel that there is a requirement for an education, health and care plan, what we will have at that point is a lot of information that will be really useful to understand the needs for your child and young person. And so those SEND family workers can help navigate that with you and the school or setting, so that we've absolutely got that really early involvement for all the services that need to. So I hope what you will begin to see and feel is us as a local authority not saying no in quite the same ways. You will know that sometimes we do have to, but actually what we do want to do is to acknowledge that if you're asking us for support, we need to give that to you in whatever way that looks like. We've also got the Let's Talk events, and some of you may be aware of those. You may have been to them. We've just started to do those face-to-face again. So our senior educational psychologists and our SEND team managers will organise those in their localities. We ran them last year, and that was a really good introduction to staff within each of the localities, and the whole concept of the locality working and what that meant, and talked very much about collaborative working. And again, I hope what you get a real sense of this evening is people working in partnership. And as Teresa said, that's very, very important to us. So we will be coming out to you with dates for the next round of those Let's Talk events. And again, they're like tonight, but they're face to face, and so it's an opportunity for you to meet professionals in your locality and to have these similar conversations. They're not designed for you to have an individual consultation about your own personal circumstances. They're very much about us seeking your views and thoughts on particular themes and key things that you are asking us to talk about. So Vic, I'm going to hand back to you because I believe there's some other questions that have popped in.
Thanks, Kath. Yep, there's a question about CCN-based provision, which I've described as inclusion hubs, and will come under that name going forward. So we're working up the model for inclusion hubs and thinking about not just the physical capacity of what an inclusion hub could look like, but actually what kind of teaching model will sit within that and how will that work with a mainstream school. And that is taking on the original CCN provisions on a bit. So all of our CCNs will convert into inclusion hubs under this new model. And we're working with the Mulberry Bush, which is an outstanding special school in Oxfordshire, to help us design that and really think through what the pedagogy within that setting will look like and how that provision will complement mainstream, as opposed to be perhaps being a kind of a part of the site, but actually not integrated within to the wider school. So so we're working on that at the moment. We're having conversations with a number of secondary schools, and I won't be able to name them just yet because those are early conversations, but we are working with a number of secondary and primary schools all across Dorset, and inviting them to be part of that. So more to come on that, and we'll keep that published. If you're not signed up to the SEND newsletter already, please do, and we'll publish more information there. But we should be coming out probably in the summer term with more information around that. Okay, Kath, if I can hand back to you just in terms of what the next question is. Thank you.
So we've got a question around evidence for an education, health and care plan. I'll perhaps talk to that and then maybe bring Miriam in as well about our person-centred approaches as well. So we will be looking for schools and settings to have used something called the plan, do, review approach, which is part of the graduated approach. And again, you may have heard of that. Local authorities have a graduated approach, which really sets out the early response to SEND issues as they emerge, and all the things that schools and settings should be doing and should be trying, so that as a local authority we can see what's working and maybe what's not working, and then understanding what more support might be needed. And that relates to what I was saying earlier about the fact that it might be that a school or a setting can receive some additional support to meet your child or young person's needs that actually doesn't require an education, health and care plan. However, we know that for a number of young people, the education, health and care plan is essential, particularly because of the complexity of needs. So we would be looking for information about perhaps the medical diagnoses, the services that you're already involved with, the support you've already received, so that we can see what's already been tried. And usually where we have said no at that initial point, it's because we haven't had that information. We haven't seen the evidence that says that actually a school or a setting have actually tried a number of different ways. And quality first teaching, of course, is really important as part of that. I'm going to hand over to Miriam because she'll talk a little bit about the person-centred approaches that we take through the service as well, and then we can see there's also a question that we'll probably bring Teresa in on as well.
Thank you, Kath. So with regards to the question around an education, health and care plan, and it's a process of an education, health and care needs assessment that you go through before we decide whether an education, health and care plan is issued. We take, as Kath says, a person-centred approach, and by taking a person-centred approach, we start by focusing on the child and the child's views of their learning, their child's views of what they enjoy, what their interests are, what their strengths are, what people like and admire about that young person, and what they need in order to be able to be supported in education. And we also, for many young people, will also include the parents' views, fundamental to that as well. So really thinking about what are your aspirations for your child, and recognising that with an education, health and care needs assessment, we need to identify whether the young person needs provision that requires an education, health and care plan. There are many young people whose needs in the SEND code of practice, it's very clear that the underlying principles in the code of practice are that most children's needs should be able to be met within a mainstream school without an education, health and care plan. If they do need that, then we make sure that we do that as a thorough assessment to identify what are the needs of that young person and what provision, what support do they need in order to be able to access learning and to continue to progress and to continue to learn at the expected level we would hope they'd be able to do. I'm going to hand over to Sam Best, because there is a question around fetal alcohol syndrome, and I think Sam will be well able to answer that.
Thank you, Miriam. I'm not well versed, but I'm happy to share my thoughts with you. So thank you for asking that question. And I guess having the bit of it's Steve's indicating that he can answer, so I will bring Steve in a little while. But I think having that piece of information that NICE are publishing some guidelines is going to be very beneficial for us. I think in terms of really getting some sense of what they're recommending around the diagnostic pathway and how we develop that. What I'm going to do now then is hand over to Steve. Thank you.
Yeah, hi everybody. For those of you that have an interest in fetal alcohol syndrome disorder, you will know that the NICE guidelines have been quite significantly delayed by COVID. They should have been released around about this time last year. And then even prior to that, the consultation period was extended. So I'm not sure who asked the question or whether it was anonymous, but you are right. We are expecting those guidelines imminently. And the thing about fetal alcohol syndrome is that it crosses many health teams. So obviously it can have an impact on both physical and emotional health. So once we get those guidelines in place, then it will fall to us at the CCG to work with our colleagues across the health teams and linking in with our local authority colleagues to actually look at that pathway and put a Dorset specific one in place. But at the moment, we are waiting for those guidelines as much as everybody else is. I'm afraid I can't say any more than that, but once we get those guidelines, then we will be looking to do a Dorset specific pathway with the teams that we have in place. But as I say, it crosses multiple health teams, which is where my responsibility comes in because I cross multiple health teams. I hope that's okay.
That's lovely, Steve. Thank you so much. And in fact, Teresa, if we can bring you in here, because we have a question from Siobhan, who's with us this evening, that I believe you would like to answer.
Thank you, Kath, and thank you for your question, Siobhan. It's an important conversation we've been having within the local authority in a much more robust way, I think, in the last few months than maybe previously. Not for any other reason than you and our children told us that actually they wanted to be able to have greater accessibility to all sorts of places, open spaces, beaches, schools and elsewhere. So it's part of our children and young people's plan. It's part of our priority to a warmer welcome, a greater belonging for all of our children. And as part of that, the accessibility strategy is being re-looked at. It was fine, but it didn't go as far as we wanted it to. And education colleagues and others are looking at having plans with those schools. Of course, we don't run schools, you know that, and we don't run academies for sure. But there's a great influencer role in the local authority, and we will take that influence everywhere we can. And having those accessibility plans shared with our schools, having those conversations, doing some visits to schools who are not as accessible as we and maybe they would like to be, gives us an opportunity to really drive that focus up, and where we need to have conversations with the academy leaders and or the DFE about making some changes to that. So it's very heavily on our agenda, and we'll make sure it's in one of our next communications about what's happening and what the timeframes for that is. Thank you.
I'm just thinking, are we going to bring Vic in here? Are you coming back in about sufficiency questions?
Yeah, I've seen a couple of questions around our sufficiency plan, so are looking at specialist provision. So I'll try and cover them off. I think it's from a couple of different colleagues, so I'll cover them off in one if I can. So inclusion hubs, will there be one at every school? In short, no, but we are looking at making sure that we have inclusion hubs across Dorset. Lots of schools have different approaches to this, so some schools have nurture provision within their setting already, but resource provision in an inclusion hub will be for children with EHCPs. So we're not looking at that in every setting, but we are looking at a really good spread based on our demographic information of where those children are, and working with schools to make sure that children have got a pathway from primary through to secondary, or first through to middle and upper, in each of our 6 localities in Dorset. Also got a question about St Mary's, so Coombe House, whether it will have residential placements. That is part of our future planning, and that is something that we're looking at, but it won't be for this academic year. Really, in terms of there's a significant amount of work that would be needed to make sure that we can do that in the right way and to a high quality, and therefore what St Mary's will do is it will open for day placements initially, and then we'll continue working alongside colleagues there to think about other provision that may be there as well, but it was part of our original planning. And then I think in terms of, there was a question about how will we measure, I've lost it in the chat now, but I think it was how will we measure progress and outcomes in inclusion hubs. And that's really key for us. So when I was describing earlier that we're working with the Mulberry Bush, part of what we're working on is how does that pedagogy link with the wider curriculum of the school, because what we absolutely don't want is our children being in an inclusion hub and then having a different teaching model when they get into the main classroom. So it's about that synergy across the whole setting, and I may come to Miriam in a moment a bit about how we would measure outcomes as well. But so there would be all of that support, but in terms of there's also the training that we offer to our colleagues in CCNs, and what we will be offering to inclusion hubs, what we call Dorset Steps, which my colleague Miriam will talk much more about as well. So Miriam, if I can bring you in on those 2 points around measuring outcomes in CCN and steps.
Thank you, Vic. Yes, absolutely. So in terms of measuring outcomes for the children in our specialist provision, particularly our CCN provision and our inclusion hubs, we will be using a framework where we will be where we evaluate the impact of the intervention using a whole range of different measures. So there'll be some quantitative measures, which will include things like attendance and attainment and access to the curriculum, but we'll also be using some qualitative feedback from the young people themselves. And we also look at measures of the access that the children have within the mainstream. So there'll be a number of those, and that's one of the things we would do right from the outset. We set the outcomes when we're setting up the provisions. We work with those schools to identify what are the outcomes going to be for the children, what are our hoped outcomes, and then we do set that baseline, and then we come back and review that. And then in terms of Dorset Steps, so one of the things that I would like to share with you is a number of strategies and interventions we're providing for as schools to improve their skills. And we have both the educational psychologists and we have our specialist teaching team, and we also have specialist teachers from our special schools that are providing outreach support from the special schools. And one of those is a trained trainer of an approach called Dorset Steps, or called Steps, and we endorse it. We call it Dorset Steps because we've taken that model and we're rolling out to all schools. Dorset Steps is an approach that looks at the cause of behaviours, looks at why a young person might be presenting the way they are, why a child might be presenting the way they are. It looks at those factors which might be internalised, so how come a child internalises or how come they might externalise, and then it asks the school will put in place a plan and an intervention plan for that particular child, a very specific behaviour sort of support plan, and asking questions around is the behaviour dangerous or is it difficult, and then you distinguish between those sorts of things. The principle behind it is that it is a whole school approach. So a senior leader needs to attend the training alongside another colleague from the school, and they will then implement that into the school. And alongside the schools, we are also training our specialist teachers and educational psychologists on the same, so they can support that implementation. So we're building the capacity in the whole system. The schools that have already taken on the approach have seen a huge change in the way that their language, the positive language that they use, the use of consequences, and the reduction of things like fixed term exclusions and permanent exclusions, particularly of children with SEND needs and those with social, emotional, mental health needs. And we will be working again with those schools to really work with them around outcomes. So for each school, it's very specific. We will work with them on an engagement process, and we have been working with them on an engagement process to ensure that the Dorset Steps approach and any training that we deliver changes practice within the school. And we come back and review that. So we are fortunate that we have trainee educational psychologists in our service who can support us with doing some of that action research and embedding it within our practices. I'm going to hand back to Kath now.
Yeah, I think we're going to bring Lisa in actually. Yeah, Darren, if we can go across to Lisa, that would be fantastic.
Thank you. I'm just going to add a little bit more to what Miriam was talking about there, and particularly in relation to the question which is around that building of capacity of our teachers to be able to meet the needs of all the children there. The question refers to a differentiated approach to teaching children with additional educational needs within mainstream schools, and I like to think about that as well, particularly in terms of that being scaffolding, putting the right scaffolding in place so that everybody can succeed and really fly. And our specialist teachers and our educational psychologists have joint planning meetings with all the schools in Dorset every term, and what they're doing in that process is consulting with the schools about particular children or groups of children, and really making sure that those schools have good training, advice, guidance, opportunities to learn from those really highly qualified and experienced professionals on how to be able to meet those needs in their school, so that they're applying what they learned across whole groups and cohorts and even whole school full of children in terms of the learning around, for example, language needs, literacy needs, numeracy needs, as well as the needs that Miriam was just referencing there as well in terms of attachment and relational practice, good relational practice. And then in terms of the question rightly talks about how we then measure the quality of that. So we have a school improvement function, we have a team of education challenge leads, and what they're doing with our schools is that they're working really closely alongside them to really understand the strengths of the school and the areas that the school needs to develop. And helping the schools to be able to move forward on that development journey. So that will incorporate actually really crucially the work that the school is doing around inclusion and making sure that that school has really great inclusive practice, and holding them really closely, but also giving them good challenge around that to make sure that that practice is really strong.
Thanks, Lisa. We can come back to me. There's been a question asked about practical-based courses, and particularly those that are for young people that are approaching transitions. There's been some really exciting work happening between children's and adult services around understanding the total journey for young people as they approach adulthood, and there's a large piece of work called the Birth to Settled Adulthood programme happening at the moment. We absolutely don't want there to be a cliff edge, and we know that for some of you, you have experienced that in the past, and so that's very much our focus, about making sure that where support needs to continue on into adulthood, that we are making sure we get ahead of ourselves, that we're planning for that well in advance, so that we in children's services aren't stacking up problems for our colleagues in adult services, and that we can plan properly in advance for that. But there's also been some work around apprenticeships and internships, and that's increasingly something that we're asking our SEND teams to consider for young people, because we do absolutely recognise that sometimes the traditional, if you like, learning environment doesn't work for all young people. So there's definitely some work happening around that, and we will certainly keep you updated as that progresses. I'm going to come back across to Sam. There's been a question asked around pathways, so Sam, if you'd like to pick that one up.
Thank you, Kath. Yes, hi again. I guess I'm thinking that this is in relation to either the development and behaviour pathway or the all-age autism review. And I think I'm probably picking up some frustration that actually improvements haven't been pushed forward as quickly as possibly they could have. I think it's such a significant piece of work, and I want to give you some assurance that both locally and nationally there is a significant ongoing commitment to improve services and experiences. Dorset CCG does have a project website, All Age Autism, which we can share the link with you, where they will continue, the project group will continue to share updates. I think from the significant amount of view seeking and co-production with our stakeholders, there are some key themes that are coming out, really around access to services is a key one, as well as diagnostic pathways. There's also, I think, themes around the impact of COVID as well, and how that has impacted on our children and young people. So I hope that gives you a little bit more of an insight. We can, of course, give you more information in terms of the insight report that the project team developed. So happy to share that. So please just let us know, and please do come back if that hasn't answered your question. Please come back to me. Thank you. I'm going to hand back to Kath, I think.
No, we're playing swapsies at the moment. We're back to Vic.
Thank you, Kath. So we had a question about expanding Westfield and Wyvern special schools in particular, but I think all special schools. With Bowcroft Special School, we had a fantastic opportunity to take over a site that was going to Hughes, which was the former Wimborne First School. So that came about fortuitously and at the same time as our a proposed investment. So there was a great opportunity where we were able to do that, and that should be opening in the autumn of this year. With Westfield School, one of the challenges there is the sites in terms of where we would build, and we're working really closely with the head teacher of Westfield School to think about how could we expand his post-16 provision. We're really proud of our outstanding special schools, but sometimes the land that they're sitting on is just limited in what we can do. So we're looking creatively at that. Don't have any specific announcements at this point, but it is absolutely part of our capital strategy. And likewise with Wyvern, but also Mountjoy and Newstock, just thinking about what can we do to expand provision in a way that's financially viable and economical, but also works in the context of their sites as well. So our SEND capital strategy is published on our website, so I'm sure we can drop a link in the chat as well, but absolutely talks about expanding our existing specialist provision whilst also looking at things like inclusion hubs and obviously St Mary's as well. So there's a number of schemes there. Our SEND newsletter is always the best place, I think, to get that information, but we'll just keep publishing latest updates on that. And then obviously the 2 free schools as well. So there's lots coming. And we've made a really good start already. So, Kath, back to you.
Lovely, thanks, Vic. And in fact, Steve has offered to come in and talk a little bit more about the internships.
Am I on? Yes, I'm on. Yeah, very briefly, because obviously I get, well, not obviously, but I get I get sent the updates from National NHS England, National Health Service England. My bulletin today is disseminating what the government is planning to do around supported internships, and there's 18 million coming into the system over the next 3 years. The plan is to double the number of supported internships, and I think as a local authority we need to be really keen on actually getting our hands on that money and doing something really positive with it. Personally, I have always been really ashamed of the National Health Service and how many people we have working in the National Health Service that have got learning disabilities or learning difficulties or special educational needs. I'd be keen to actually see some of those internships actually within our own systems.
Thanks, Steve. That's really helpful. We're slowing down a little bit in terms of questions in the chat bar. Thanks ever so much for somebody's come back on Lisa's input, and there's an additional question there, Lisa. So perhaps if we can pull you back in there, and it's probably between Lisa and Miriam actually, and around the SENCO groups supporting across the leadership. SEND is an equal responsibility, not just directed towards SENCOs. So it's a bit about differentiated teaching responses, Lisa.
I'm just searching for it in the chat, Kath.
Actually, if it's helpful, Lisa, do you want me to just read it for you?
Thank you.
It was one of those things for colleagues. So apologies for the slight delay. So thank you for Lisa. Your answer is really helpful. Will the differentiated teaching approach support SENCOs to garner support from the mainstream school leadership that SEND is across school? It's an equal responsibility and not just the SENCO's responsibility.
Thanks, Kath. I still can't see it, so I'm glad you read it out for me. Yes, absolutely. That is so crucial. Obviously, you know, we would encourage SENCOs to be part of the leadership team, and that is good practice for them to be part of that leadership team. But where they aren't, and it isn't always possible, particularly in smaller schools, then we would absolutely advocate that all the leadership team, all the teachers, all the staff actually are prioritising understanding the needs of all the children in their classes. We have a SENCO forum, which absolutely gives our SENCOs the opportunity to come together and share good practice. That's led by our senior educational psychologists, and really enables them to get into that space where they can learn from one another and learn again from our expertise as well. So it's really, really important that that is absolutely seen as everybody's business, as we know. Miriam, is there anything you wanted to add there?
Thank you. I think actually, Lisa, you've answered it beautifully. The code of practice very much says that every teacher is a teacher of children with special educational needs, and that's very much our aim. So when we're working with our schools, we are looking at that whole school approach and ensuring, so the principle behind our inclusion hubs and the complex communication needs resource provisions is that the expertise is shared and spread. So you have the expertise of some particular staff, but their job and their role is to work with all teachers within that school to differentiate, to mediate for the child and to differentiate the curriculum, so that child can be able to access the same curriculum and equally, and to provide those scaffolds. So the whole model of the inclusion hubs is that the child is included within the whole school and the expertise is shared across the whole school system. I'm just beginning to type, actually. There's an answer. I'm just going to step in there. Dorset Steps, there was a question about parents and should that be a whole approach including parents? Absolutely. So whole school approach does include parents. The framework that we use when we're looking at whole school approaches to emotional health and wellbeing, we use a public health framework, which was around promoting emotional health and wellbeing, and one of the domains on that is about parents. So when schools are implementing it in their schools, they should and could and can involve parents in that. They may not involve them in every aspect of it, but they should certainly, as part of that approach and that engagement process we're taking them through, is to work with the parents as well. You are part of the school community, and it's important that you are also using the same approaches and understand the approach that the school is taking, so you can be consistent in your approach as well as a parent.
Thanks ever so much, Miriam. Vic, we'll hand back to you.
Thanks, Kath. So there's a question in about joint working between education and health, and sometimes where that's working well and other times not. So I think if I describe a bit about how we do work together with our CCG colleagues, so Sam Best and Steve in particular, and then possibly Sam, I can hand to you a little bit. So we have a partnership agreement which we are about to publish today, actually, and that really enshrines our close working between the CCG, but also with our Dorset Parent Carer Forum as well. And that will be published on our local offer and in our newsletter the next opportunity. So that will be coming out. In terms of how we work together, so in terms of our ways of working, our decision making is collaborative. Our decision making is with Health Together. So we work regularly with Steve in terms of the way we make decisions on education, health and care plans and provision, and that also involves the bringing together of advice through our educational psychologists, but also sometimes our health services where we've got additional advice coming in from there as well. So there is joint working there. We know there's much more we can do to integrate our offer more. In terms of the query about educational psychologists, we offer that service to our schools. So our educational psychologists have a termly planning meeting with every school to think about emerging needs, to think about children with EHCPs, and just to do that joint planning with schools as well. So there's many opportunities for schools to work with us. We'll potentially take the specific query that's in that question offline just to understand that a bit more. But Sam, if I can hand over to you for a bit more about how we work together.
Thank you, Vic. I think I'd just like to agree with you, Vic, in terms of sort of developing our joint working. I think it's central to everything that we do, and I think part of this is around really making sure that we think about a child or young person's needs and which service fits best to meet those needs. So we're not necessarily talking about a diagnosis. We want to think about what is a child's needs, what's their family's needs, and who in our partnership can best help. So there is a very strong commitment to working together. There's also a very strong commitment to understand the journey of our children and young people, their families and carers, and we're told many times actually that people have to tell their story more than once to lots of different services, and certainly we're trying to pull that together and join up a little bit more. So that is a priority for us. And I'm going to bring Steve Clark in now, who also wants to add something in. Thanks, Steve.
Yeah, hi there. The question that came in regarding referrals getting bounced between the paediatric teams and schools. This is something that I am very aware of, and my associate DCO is aware of. It's not rife, but it does happen, and there does seem to be a misunderstanding sometimes between the paediatric teams and the schools. We're trying to address this. We're addressing it through the pathway meetings that we have regularly, but also we are addressing it through the neuro disability support nurses that are within the paediatric teams, actually meeting with the Senkos within the school and getting that link there and doing some training and having some understanding of what the different roles are. Sometimes, and this isn't an excuse, but sometimes the paediatrician is trying to follow almost like a health graduated response, in that you'll find a paediatrician is not, no health professional is particularly keen to give a lifetime diagnosis to a child unless they're absolutely sure that it is right. So sometimes they go back to the school and say, are you sure you've done everything to meet the needs of this child, before we do an assessment and maybe give them a diagnosis that is going to stick with them for a very long time. And I know that for parents and for families that those diagnoses can be very, very useful. They shouldn't necessarily have to be, but we do understand that. I just wanted to assure that person that, and I know Kath's already reached out and said that, that we're more than happy to link in directly with you and unpick that question properly. But in some instances there are broader issues to why sometimes those referrals get batted backwards and forwards. I'm not happy that it happens. I feel that if a referral isn't particularly appropriate for a service, they should be forwarding it on to whoever is appropriate rather than just bouncing it back. But that is a work in progress, and there's work that we're having to do with our paediatric teams and with our schools and our colleagues within education. So it is it's not something we've got our head in the sand about, put it that way.
Thanks, Steve. That's really helpful. And we've had a question asked about support for post-16s, those young people who have a plan but are out of education or training. I think you'll be aware that the old NEAT service that was offered by Ansbury has now come back into the local authority, and we've inherited quite a number of staff, but very small number of total hours. Servicing, so that's very much focused on those out of education, so working very closely with colleagues in that new service to support young people, and clearly our young people with additional needs are very much a priority for us. We do know there is more work to do, so it's a really reasonable question. Thank you. We've talked before about some of the other options that we're exploring around internships and apprenticeships, but there is definitely more to do around that. We've also had some questions asked around early years. So Vic, I'm going to bring you in here if that's okay.
Thank you, Kath. So in terms of early years, we have a funding pot that we make available to early years setting called SENIF, which is another one of our acronyms in education, but which is essentially an inclusion fund, so SEN inclusion fund, which early years settings will be aware of. So if your child is in an early years setting now, they'll be aware of how to access that and work with our team on getting support quickly. So it's not quite like the EACP process, which takes 20 weeks. And it's something that can be made available quite quickly to early years settings to support need early, and that's something that your setting would bid for, working with our colleagues in the council as well. So that is a specific pot of funding available to support early identification of SEN and putting in place resources and support that your child would need. And there's a process around that is visible on our local offer, but the setting would be familiar with. Kath, I'll come back to you on any other questions that we've missed so far. Hopefully that answers that one.
I think we're pretty much up to speed on the questions, and we're coming up to probably towards the end of the session. There's no new ones that have come in. Some of you we may well have given private responses to, and we will have shared our contact details with you individually where there were specific things that we could probably pick up with you. And there was a question raised earlier about knowing the roles, the job titles and the names of all of us here talking to you this evening, and we absolutely will do that when we publish the links to the recordings and the summary of all the questions that have been asked. We will provide that information as well. So we'll just pause there to see if there are any other questions coming in. And Vic, I'm likely to come back to you then for a bit of a summing up.
Thank you, Kath. There is one last question which I will pick up, and then which is around I think the substance of the question is about inclusivity and mainstream, and what do we do when it's not good enough. And I think whether it's a school or academy, it still remains with us as the local authority to support and to think about how we can work with, whether it's an academy chief exec or a head teacher, whether that's one of our schools or an academies, to use that intelligence and understanding and really think about what support we may need to put in place and what conversations we may need to have with schools as well. So in terms of reporting, I'll drop my email in response to that question in just a moment. But the reporting is, there are a number of ways, but we always want to look at this in a strengths-based way. We as a local authority put a lot of support out for schools and academies like Dorset Steps, like our CPD offer, like our outreach. Our educational psychologists meet with mainstream schools and primaries and secondaries, as well as academies, as do our specialist teachers. So the support is always there. For head teachers, and we have good relationships with our heads and academy heads as well, where we talk about how that works and how they can access that. But also in particular around Dorset Education Advice Line. So that's there for SENCOs, for classroom teachers, for head teachers, for governors, but also for you as parents, as a way of, I suppose, requesting support or thinking about where you may have questions about a learning need that you're identifying. Or even if you've got concerns about your child is not getting the provision they need and may have a learning need, the Education Advice Line is there for you to have that in a conversational way, and really to make sure that we're fully understanding all of the concerns. So there's a number of ways you can work with us on that, but I will also reply in a moment in the chat to that one. But just to round off, I don't think we've had a couple of new ones. I don't know, Kath, have we answered those already? Or...
Yes, we've picked those ones up individually.
Thank you. We're getting late into the evening, so I'm very conscious that you will be wanting to spend time with your own family and your children, and really grateful for you giving us the opportunity to talk more about our services and the journey we're on. Thank you to my colleagues in CCG for joining us. It's really important that we keep these kinds of conversations going, and we'll continue that both in terms of local Let's Talk events, but also more events like these. And in particular, a real theme around our specialist provision. There'll be lots more information coming out in our newsletters around where we're expanding provision, what that looks like, and more detail on those things as well, alongside the other points. In terms of today, so today we've met a total of about 50 parents, which is fantastic. I think that it's just great to see that engagement from families, and we know how busy you are. So we thank you for your time, but in our next newsletter we will put out a bit of a "you said we did" and just talk more about the themes that we've picked up and our learnings from these events, and how we'll be responding to that through our work. So thank you all. Thank you to colleagues who are in the room with me, who've been answering questions for you. Hope you found that useful, and wish you a lovely evening. Thank you.